Welcome to the Webster World Report, a special program linking Webster University's global operations during the pandemic crisis. And now, here's our host, Rick Rockwell.
Here we are with the 7th special edition of the Webster World Report, keeping you connected in our disconnected world of social distancing. This week, we hear from the front lines. A Webster nursing student speaks of his experience in COVID-19 wards in St. Louis. Also, the Dean of the College of Arts and Sciences on the efforts of his college during the pandemic, and what it's like to experience lockdown in Uzbekistan. But first, let's hear from newscaster Tierra Gray.
A Webster University professor is working with colleagues at St. Louis University to once again hold a summer bee census called ShutterBee. Webster professor Nicole Miller-Struttmann is one of the organizers of the project.
You don't have to go anywhere. Basically, you just walk outside, walk through your garden, take pictures of bees, submit them to iNaturalist, and then we identify them and get a whole bunch of information out of them.
Volunteers are needed to help conduct this census that measures the bee diversity in the region. Training sessions for the bee census will be held on May 21st and May 23rd. Volunteers can conduct the census while social distancing. To sign up for the project, look for the ShutterBee project on Google Sites, or look for more information in Webster Today. President Julian Schuster and the university's new task force on transition and adaptability have announced that Webster's main campus in Webster Groves will remain on modified and remote operations through at least June 15th. However, a few administrators and staff members may return to the main campus from remote operations as early as next week. The university assembled the new task force to begin planning for how the university will operate moving forward through the pandemic. Except for China and Ghana, most of the university's international campuses will likely begin a phased return to in-person operations for staff this summer, with social distancing and extra health precautions in place. That phased return could begin as early as next week in Ghana. The university remains on remote operations in China. All summer courses will be taught remotely. Like much of the Webster system, Webster University Geneva has started its own way to engage the community. That campus has created a virtual lecture series highlighting the works of various faculty members during the era of the coronavirus. Webster Geneva calls the series The Looking Glass, and those with an interest can join from all over the globe. Geneva has already held lectures on visual semiotics during the pandemic and on better business negotiations. The next global live stream of the series will be held on May 28th at 6 p.m. Central European Summer Time. That lecture will feature Professor Vlad Glavianu, head of the Department of Psychology and Professional Counseling at Webster Geneva. For more information, please check Webster Today or the Facebook page of Webster University Geneva. Webster University held its first ever virtual commencement this past week due to the coronavirus pandemic. Thousands of people worldwide tuned into the ceremony that streamed live on the university's website and on Facebook. Vladimir Ivkovic, a neuroscientist at Harvard Medical School and Massachusetts General Hospital, was given an honorary degree and gave the commencement address.
As you contemplate the next steps in your life, remember that we are all responsible to help make the world a better place. No exceptions. At every step of your way through life, remember that privilege is not equally distributed around the world.
Ivkovic also has served as a researcher for NASA. Will Carpenter, a scientist who was part of the team that won a Nobel Prize for the banning of chemical weapons, was also given an honorary degree at the ceremony. The ceremony can now be seen on the university's YouTube page. Congratulations and much success to the graduating class of 2020 for their hard work. We are proud of your achievements and perseverance through a global pandemic. For the Webster World Report, I'm Tierra Gray.
Thanks, Tierra. Our next guest, Charlie Johnson, is a Webster graduate student and a registered nurse. He shared with us his experiences being a frontline healthcare worker during our pandemic times. He joined us via Cisco WebEx from St. Louis.
It's been definitely a challenging time for us in the hospital, but we are working through it every day with great leadership and getting the job done. It's been a little challenging with school because of the demands of the job, but everybody's pushing through and working things out.
So professors have been willing to cut you a break on some work, and they've been flexible?
Yes, they've been very accommodating and understanding.
I wonder a little bit about your work life right now. Are you seeing any patients with COVID-19 yourself?
Yes, we do see patients with COVID-19. We see some that come in with symptoms, but aren't positive. And that was because, this came on just as the flu season was in its prime or right, going down the tail end of it. But so there was a mix of flu and COVID. But we have been seeing COVID patients.
Tell me a little bit about how you are coping. You're seeing patients with a highly infectious, contagious disease. How do you deal with that as a nurse on the front lines?
You go into nursing wanting to help people. That's in the front of your mind foremost. Is that you see sick people and you want to help them. So that's how I cope with it. I know I have a job to do. I'm performing a service that's unique during this time. It's actually gives me a sense of gratification to be able to be part of this and to provide care for those patients.
What sort of adjustments have you had to make in your own personal life to provide safety, and how do you prepare as a nurse going into those situations? What's your protocol as you make yourself safe in those situations?
I fall back on training. We were taught how to effectively wear our personal protective gear. You make sure that you keep yourself safe, and that way you're able to keep your patients safe. So effectively utilizing your PPE and what we call donning is applying your PPE and then doffing, taking it off in a safe manner, and make sure everyone's staying safe. That's the key right there.
What can you tell us about the experience of your colleagues? Are they coping as strongly as you are? Do you see sort of a uniform response to the virus?
When it first started, of course, with anything new, there's a little sense of anxiety. But I will say, the team has been extremely amazing responding to the demands of this pandemic. And like I said, our leadership has just been amazing, being there to answer questions and to provide guidance around this COVID, with this daily connection with leadership, with outside organizations. The anxiety levels definitely decrease, and allowing staff to effectively work to take care of these patients.
I wonder if you have any message for other students, other nursing students, or just anyone in the Webster system.
I say, we will get through this. Just stay positive. Webster's a great school, and I'm sure that they're doing everything to accommodate and help the students while we go through this. I will say that for them to stay safe and also follow those guidelines, that come down by the university or the CDC, and that way we all stay safe, and eventually we'll be able to get back to normal business and get back into class and engage with folks and all that.
Before you came on this program, and you were invited to come on. I'm sure you thought about something that you wanted to share with me and with our listeners. So is there anything that you thought about that you wanted to share that we haven't had a chance to chat about yet?
I just wanted to share that as a nurse, and we're just not in this alone. I want to say society and media has given a lot of attaboys to healthcare professions, and we're out here doing a good thing. But I say it takes everyone to fight this pandemic. And I just want to say to everyone, just go through and do your part. We'll get through this. There's light at the end of the tunnel, and we will get through this soon.
That is something you mentioned, that this is historic, that most folks have never lived through anything like this in their lives. And we're also seeing this appreciation for nurses in a way that I don't think we've seen perhaps ever before. There are military flyovers and other things to honor first responders. What is your reaction to this historic change in honoring the good work that you're doing?
Oh, I think it's amazing. I know that the nurses really appreciate, they really appreciate the outpouring of affection and gratitude from folks because they are just doing amazing work around this COVID. Looking forward, I really hope this sets a platform for other issues that we see in our society, like homelessness, mental health, education. The way that we've come together as a community is amazing, and I just hope it just keeps going forward. I will say we've been really fortunate here in St. Louis that we didn't get the uptick in COVID patients like other regions. I think that initial quarantine and social distancing that came down really helped us out a lot. As they start opening things up, of course, we're going to see more cases, but it's not going to impact the system if we didn't do those things, a month and a half ago. So we're ahead of the game, and I think at the end of the day, we never like to see anyone lose their life, especially for, a virus that came out of nowhere. We will make it through. And hopefully this is a, learning point for a lot of people, and the way we do things and the way we approach healthcare. And if this were ever to happen again, we will really be able to effectively control it even better than we did this time.
Well, we thank you for your service and for being on our program today. Charlie Johnson, a registered nurse and graduate student at Webster University, joining us via Cisco WebEx from St. Louis, Missouri on the Webster World Report. Thank you.
Thank you.
Coming up, the Dean of the College of Arts and Sciences talks about more efforts from students, staff, and faculty to help during the current crisis, and lockdown in Uzbekistan. More from the Webster World Report in a moment.
Educational affordability is one of our missions at Webster University. We've honored this by not increasing tuition rates until May 2021. To schedule a virtual visit with a transfer admission counselor, or attend an admissions and scholarships virtual session, or participate in academic information sessions to learn about our programs, visit webster.edu/transfer.
Webster University's online MBA in Management, Leadership, and Education graduate programs were ranked as the best online programs by the 2019 U.S. News and World Report. Learn more about our award-winning online MBA. Programs created for you to help you succeed. Visit webster.edu/succeed.
Welcome back to the Webster World Report, and now our interview with Dr. Toni Wallner, Dean of the College of Arts and Sciences. He joined us via Cisco WebEx from Clayton, Missouri.
Our faculty and students actually have really chipped in to help and gone above and beyond. From our biological sciences department, at the beginning of the crisis, they donated personal protective equipment to local hospitals because these were equipments that the students would have used in laboratories, which weren't occurring because we didn't have face-to-face instruction. So they donated that to help the first-line responders in their initial interactions with COVID-19 patients. We have our counseling faculty have actually looked at telemental health options. The social isolation leads to, as you can imagine, additional stresses and challenges for people. And the opportunity to meet face-to-face is not there. So providing our students with these training opportunities so they can participate in telemental health also has been a great addition for our counseling students. And our nursing faculty and nurse anesthesia faculty and students, as you can imagine, have truly been at the front lines. We have students and some of our science students as well have been working at locations, labs, urgent care clinics where they're doing COVID-19 testing, we have some students working with the county health department and the city health department on their COVID-19 phone lines, providing information to people who are calling in with variety of questions about the pandemic and the virus. And the nursing students and faculty are still working in hospitals, providing care that is necessary for all patients. So and those are just a few, but some great examples of how the faculty, staff, and students really have pulled together to help the larger community address this pandemic.
I think we've also seen staff, faculty, others, students too, reach out in special ways, not just in College of Arts and Sciences, but in this virtual environment, trying to provide things for our community, both the Webster community and the Webster Groves community and the international community at large. I want to call out specifically, you've got Coach Matt Seitz, who does exercise science for you, has been trying to help people with virtual workouts. Haven't some of the folks doing exercise science also been trying to help the community with a different part of mental health, that sort of exercise at home part?
Right, that's certainly been a challenge for people with the various gyms closing, along with most other services. And so we certainly have our Director of Exercise Science, Dave Reddy, and as you mentioned, Coach Matt Seitz, have provided sort of what are some routines and exercises that you can do for a variety of populations. So people who have routine fitness programs, people who maybe have some mobility issues, some senior citizens, a variety of different populations, and providing the appropriate level of exercises that can be done at home safely and effectively to maintain and maybe even improve their overall physical as well as mental health. I mean, they're connected. So being able to maintain physical health can help with some of the stresses or challenges that people may be facing because of being socially isolated. All of that is interconnected.
You have found a particular media niche during this crisis and wanted to talk to you a little bit about this. You have become, at least, I'm going to say, in maybe not completely nationally famous, but in certain localities in the United States, you've been on the news helping people figure out how they can put together their own home hand sanitizer. Could you tell us a little bit about that experience?
Well, sure. I mean, of course, the best line of defense, as I'm sure you've probably talked about on your podcast before, is washing your hands with soap and water. But that is for 20 seconds, and that is not always available. And so the next best option is hand sanitizer. But as I'm sure you've also noticed or can imagine, most of those cleaning products and hand sanitizer products have become a bit in short supply in your various grocery stores and pharmacies. And you can find some of these online, sometimes hand sanitizer options, but they, to me, have been perhaps increased in price a bit. So what can people do in terms of accessing sort of safe alternatives that are also economical? So there is a publication out by the World Health Organization that talks about creating hand sanitizer that is easy and economical for the world and effective. And so looking at that recipe, and then for people in North America, translating it from metric measurements to North American measurements. So instead of milliliters, which is the sort of metric unit of volume, converting it to cups, teaspoons, tablespoons, measurement devices that people would have in their home. So the recipe is actually quite simple. You can use isopropyl alcohol, 99% isopropyl alcohol, 3% hydrogen peroxide, glycerin. Glycerin can be difficult to find, or you might not have it, so you can substitute aloe vera gel that you use for sunburns, and then distilled water. And if you don't have distilled water, you can just use boiled water and cooled. So those 4 items, mix them together in the appropriate proportions so you have the correct concentrations that have the antibacterial properties and antiviral properties, and mix them together, let it set for 72 hours, and then you can use it to clean your hands, just like soap and water, putting the hand sanitizer in your hands, rubbing them for 20 seconds all over to make sure that any contact you've had with the virus will be cleaned.
Some people don't know that you are a chemist, and I wonder how you react to the fact that you have some local fame, other fame throughout the United States now for sharing this recipe. Andy Warhol said that everybody will be famous for 15 minutes. Is this your Warhol moment, and what is your reaction to that?
Perhaps it is my Warholian moment. I guess maybe there are other things that I've done in my life that might be a bit more appropriate in terms of being bringing fame and attention to myself, but that's for each individual to decide, I guess. But if providing these recipes and resources to people so they can access safe, inexpensive hand sanitizer, if that makes me famous and we provide it as service to people and it gets the attention of Webster University, I'll take my 15 minutes of fame at this point as well.
So thank you very much. Our guest today on the Webster World Report, Dr. Toni Wallner, the Dean of the College of Arts and Sciences at Webster University, joining us via Cisco WebEx from Clayton, Missouri. Thank you.
Thanks, Rick.
This week, we journey back to Uzbekistan, this time to hear from Maggie Dankert. She's the Deputy Director of Webster University Tashkent. For an American living in Central Asia, she told us lockdown in Uzbekistan is very different from staying at home in the United States. Here's the first part of our interview. She joined us via Cisco WebEx from Tashkent.
The lockdown here happened really quickly. So March 11th at 9 a.m., we had our first confirmed case. And then by 4 p.m. the same day, the government shut down all universities and schools. So I was actually at a TEDx event in Bukhara, listening to one of our students give a talk. And we left and went back to Tashkent, and everything was in lockdown procedure. So students had 3 days to return to their home countries before all trains, buses, metros were shut down. Within a week, taxis were shut down. And then a few more days later, they actually said no more driving your own personal vehicle. Every store has been shut down except pharmacies and grocery stores. I have a armed National Guard member post outside of my apartment complex, and he basically asks me every time he sees me, "What are you doing outside?" And I have to say in very broken Russian, "Look at my dog. I'm giving her a walk." And then sometimes he smiles and lets me through. It's been, we have people in full gear coming and spraying and disinfecting all of the walkways and the sideways and the apartment entrances. We had a few people go into government quarantine, which means they were connected to someone who was sick. So there were camps set up outside of the major cities where they turned old shipping containers into apartment complexes, I guess you could say. And they were in this giant square in the middle of like this valley. And that was where you stayed. One of our faculty members he was coming home from Russia, and he and his family stayed there for 3 weeks. And it's a shipping container with a toilet and a stove, and everything is provided for you, whether it's, food or medicine or regular checkups multiple times a day. And then you are let go, and they put you on a bus and drop you off kind of in the middle of town and hope that you get home, because there's no metro, subway, bus, car. So you kind of walk home from where you are. But overall, I have generally felt more safe being in Uzbekistan than being maybe back in the United States, as an example. We are 2 months into our lockdown procedure, and we've only had approximately 2,500 confirmed cases of COVID-19 and less than 10 deaths, all of who were people who came from outside of Uzbekistan into the country. So while the lockdown and the quarantine procedures have been, maybe not something that as an American I would be used to experiencing, they have been effective. And we just got the announcement that they're going to hopefully be softening those procedures so that people can come back to work or go to restaurants or things like that. Yeah, it's been an interesting experience.
So I'm curious, if you're not able to go more than 100 meters outside of your apartment complex, then how do you get to the store? Or are you allowed to go to the store, or do the stores deliver? How does that work?
My grocery store is 2 blocks away. So it is just past the 100-meter mark. The pharmacy, there's like a pharmacy on every street corner. So it's one of those things that like every block has one of those. For the first couple weeks, I was having food delivered to my house through like a private food service. But when the personal cars got made illegal, that got stopped. And instead now, what I've been trying to do is there is a white minivan that comes into the middle of my apartment complex, honks his horn very obnoxiously, but then he sells a bunch of produce and a bunch of like eggs and fresh milk. And there's a little bread stand, within my apartment complex. So most of the food I'm able to get like right outside my front door.
We'll hear the second part of our interview with Maggie on our next program. And that means it's time for a programming note. The Webster World Report will be offline next week. We plan to have a new special for you on May the 29th. Thanks for joining us this week on the Webster World Report. We'd like to add your voices to our program. If you're a student, a staff member, or a member of the faculty, reach out to us. Send us a short audio clip from your cell phone or contact us via email to volunteer to be interviewed on the program. You can find us at covid19@webster.edu. You can also send questions or comments to that email address if you want to interact about the crisis. That address again is covid19@webster.edu. Also, check out the university's COVID-19 resource pages at webster.edu/COVID-19. You can also hear our report on KWRH-FM Radio 63119. That's 92.9 FM in Webster Groves, Missouri. Thanks for joining us this week. The Webster World Report is produced by students, staff, and faculty at Webster University. For news reporter Tiara Gray, associate producer Jennifer Gamich, and announcer engineer Jim Singer, I'm Rick Rockwell. Stay healthy and safe.
The Webster World Report is produced by the Global Marketing and Communications Division of Webster University and through the facilities and copyright support of Webster School of Communications. This program is copyright 2020.